The dismissal started when I was 16. Community service hours don't impress anyone, Mom said, watching me sort donations at the local food bank. Your sister is studying pre-med. That's real ambition. I nodded and kept folding clothes. Sarah was 3 years older, brilliant, confident. She became a pediatric surgeon by 32. Our parents displayed her achievements like trophies. Framed diplomas, award plaques, newspaper clippings about a rising star in pediatric medicine. My volunteer coordinator certificates went into a drawer. I worked at the foundation throughout college, starting as an intern processing grant applications. The Martinez Foundation had been established by a tech billionaire in 2008, focusing on healthcare access, education equity, and poverty relief. By the time I graduated, I was analyzing funding proposals. Nobody in my family ever asked about my work. They assumed I was a low-level administrator still doing paperwork for charities. Uncle Robert would ask at family gatherings, "When are you getting a real career?" I'd smile. "The work is meaningful to me." Sarah would laugh. "Meaningful doesn't pay 6 figures." She earned $340,000 annually as chief of pediatric surgery at Metropolitan Children's Hospital. She mentioned it often. Her house cost $1.8 million. Her car was a Tesla Model S. Her vacation photos from the Maldives filled Instagram. My apartment was modest. I drove a 10-year-old Honda. I wore simple clothes. "You could do so much better," Mom would sigh. "You're smart enough. You just lack ambition." What they didn't know was that I'd been promoted 7 times in 12 years. At 29, I became the youngest director of grant operations in the foundation's history. At 31, I joined the executive board. At 33, I was offered the position of chair. The foundation's endowment had grown to $3.2 billion. I approved or denied funding requests worth hundreds of millions annually. My decisions affected hospitals, schools, research facilities, and community programs across the country. Grant applications crossed my desk from Nobel Prize winners, university presidents, and hospital administrators, including, eventually, my sister's hospital. But first came Thanksgiving. Dinner was at my parents' house in suburban Connecticut. Sarah arrived in her Tesla, her husband Marcus behind the wheel. He was an orthopedic surgeon. They'd met in medical school. "Emma." Sarah hugged me, then stepped back to inspect my outfit. "Still shopping at Target?" "It's comfortable," I said. "Comfortable," she repeated like it was a foreign word. "Well, I suppose that's what matters when you're not building a career." Mom had set the table with her fine china. Dad carved the turkey with ceremonial importance. Sarah and Marcus sat in the positions of honor. I was at the far end next to our cousin Jennifer, who worked in retail. "Sarah, tell everyone about the new wing," Mom prompted. Sarah's face lit up. "The hospital is expanding pediatric oncology services. It's a $45 million project. State-of-the-art facilities, family-centered care, advanced radiation equipment, integrated research labs." "That's wonderful," Aunt Patricia said. "We've secured $18 million from the state and another $12 million from private donors," Sarah continued. "But we're applying for a major foundation grant to complete the funding. If we get it, we can start construction by spring." "You'll get it," Dad said confidently. "Look at your credentials. Any foundation would be lucky to fund your work." Sarah smiled. "I hope so. The application's going to the Martinez Foundation. They're the largest healthcare-focused foundation in the region. Getting their backing would be transformative." My fork paused halfway to my mouth. The Martinez Foundation. My foundation. I said nothing. "How much are you requesting?" Uncle Robert asked. $15 million, Marcus said. "It's a competitive process, but Sarah's program has exceptional outcomes. Our pediatric oncology survival rates are among the highest in the Northeast." "They'd be stupid not to fund you," Mom said. The conversation shifted to Sarah's recent television interview about childhood cancer treatment. Mom had recorded it and made everyone watch. "Little Emma, you're quiet," Aunt Patricia observed. "How's your charity work?" The way she said charity work made it sound trivial. "It's going well," I said simply. "Still doing the same thing?" Sarah asked. "Administrative stuff?" "Yes." "You know," she leaned forward, "if you wanted to transition into something more substantial, I could probably get you an interview for a hospital administration position." Entry level, but it would be a start. That's generous, I said. I'm content where I am. Sarah exchanged a glance with Marcus. Content? Sure. But don't you want more? Success, recognition. I have what I need. What you need, Dad interjected, is ambition. Look at your sister. She's changing children's lives, making a real difference. Emma makes a difference too, Cousin Jennifer said quietly. Volunteer work matters. Sarah laughed. Volunteer work is for people who can't handle real careers. It's participation trophy territory. Nice but meaningless in the actual world. Sarah, Mom said gently, but she didn't really correct her. I'm serious, Sarah continued. Emma, you're 33. You should be building something by now. A career, financial security. Instead, you're playing charity worker like it's a college hobby. Marcus nodded. The nonprofit sector is noble, but let's be honest, it's where people go when they can't compete in real professional environments. That's not fair, Jennifer protested. It's realistic, Sarah said. Emma could have gone to medical school, law school, business school. Instead, she chose to process paperwork for donations. It's embarrassing, honestly. The table went quiet. I cut my turkey carefully. You're entitled to your opinion. It's not opinion, Sarah said. It's fact. Charity work is for losers who can't make it in competitive fields. It's the professional equivalent of living in your parents' basement. Dad chuckled. That's harsh, Sarah. But accurate, she insisted. I love my sister, but someone needs to tell her the truth. She's wasting her potential on meaningless volunteer coordinator positions. It's not meaningless to the people we help, I said calmly. Oh, please. Sarah rolled her eyes. That's what everyone in the nonprofit world says to justify their irrelevance. Meanwhile, those of us in actual careers are solving problems, saving lives, building things that matter. Your hospital is applying to a nonprofit foundation for funding, I pointed out. That's different, Marcus said. Foundations are investment vehicles for wealthy donors. The people who work there are glorified paper pushers. The real impact comes from institutions like hospitals that actually deliver services. Sarah raised her wine glass. Exactly. Foundations exist to fund people like me. The workers there are just middlemen. No offense, Emma, but your job is basically sorting mail. I smiled and took a sip of water. Maybe it's time to grow up, Sarah added. Stop playing in the nonprofit sandbox and join the real world. You're smart enough, you just lack drive. The conversation moved on. Sarah described her hospital's recent achievements. Mom beamed with pride. Dad asked detailed questions about the grant process. I finished my dinner in silence. The grant application arrived on my desk the following Tuesday. Metropolitan Children's Hospital. Requesting $15 million for pediatric oncology wing expansion. Principal investigator. Dr. Sarah Chin, Chief of Pediatric Surgery. I read the 50-page proposal. It was impressive. Detailed architectural plans, comprehensive budgets, outcome data, letters of support from medical organizations and patient families. Sarah's credentials were listed prominently. Harvard Medical School, Johns Hopkins residency, published researcher, award winner, television appearances. The application would go before our grant review committee the following month. As foundation chair, I would lead the evaluation process. That evening, Sarah called. Hey, did you have a good Thanksgiving? It was fine. Sorry if I was harsh, she said, though she didn't sound sorry. I just worry about you. You're capable of so much more. I appreciate your concern. Listen, I wanted to ask, do you know anyone at the Martinez Foundation? I know you work in the nonprofit world. Maybe you have connections. Why do you ask? Our hospital applied for a major grant. It'd be helpful to have an inside perspective on their process. Anything you could tell me about how they evaluate applications? I'm not familiar with their specific process, I said truthfully. He sounded disappointed. I thought maybe your charity network would overlap. Well, if you hear anything, let me know. Sure. Thanks, Emma. Really, think about what I said. You're 33. It's not too late to start a real career. I could help you. I'll think about it. After we hung up, I returned to the grant application. I'd review it with the same rigor as every other proposal. No favoritism. No personal bias. That was my professional responsibility. The irony wasn't lost on me. The debate in the boardroom was tense. Perhaps we could approve the grant with conditions, Dr. Phillips suggested. Require them to increase charity care percentages as part of the grant terms. That's possible, I replied, but it would require significant monitoring and enforcement. It shifts our role from funding existing commitments to mandating new priorities. The discussion continued for nearly an hour. Finally, we took a preliminary vote. 4 members supported approval with conditions. 3 members, including Margaret and David, opposed funding. As chair, the deciding voice was mine. I'm requesting additional information from the hospital, I said. Specifically, I want a detailed plan for how they'll increase healthcare access to low-income families. If they can demonstrate a genuine commitment to equity, we'll reconsider. Otherwise, I'm inclined to direct our funding to hospitals already serving underserved populations. Dr. Phillips looked disappointed but nodded. Fair enough. That afternoon I drafted the letter myself. 3 days later Sarah called furious. The Martinez Foundation rejected us, she said. Can you believe that? I'm sorry to hear that, I said carefully. They said our healthcare equity metrics were insufficient. Healthcare equity metrics. We save children's lives. What does equity have to do with medical excellence? I assume they have specific funding priorities. It's bureaucratic nonsense, Sarah fumed. Some paper-pushing administrator who's never saved a single life is judging my program. My survival rates are exceptional. My patients thrive. But apparently, that doesn't matter because we don't meet some arbitrary diversity quota. I stayed silent. The worst part, she continued, they offered to reconsider if we submit additional information. Like I have time to jump through hoops for some low-level foundation worker who doesn't understand actual medicine. Maybe the additional information would help your case, I said. Help my case. Sarah's voice rose. I don't need to justify my work to charity administrators. My outcomes speak for themselves. This is exactly what I said at Thanksgiving. Nonprofit people live in a fantasy world where paperwork matters more than results. Perhaps they're trying to ensure the funding creates maximum impact. Maximum impact is saving children's lives, Emma. Which I do every single day, while foundation workers sit in comfortable offices pretending their bureaucracy matters. I took a deep breath. Sarah, I need to tell you something. What? I'm the chair of the Martinez Foundation. Silence. What? She finally said, her voice faint. I've been with the foundation for 12 years. I was promoted to chair 2 years ago. I led the committee that reviewed your application. More silence. You, she whispered. You're in charge of the foundation? Yes. The $3.2 billion foundation? Yes. You rejected my application. The committee had concerns about healthcare equity. Your hospital's charity care percentage is 6%. We typically fund institutions providing 12 to 18%. Your patient demographic skews heavily toward affluent families. Our mission prioritizes access for underserved populations. Sarah faltered. You're a charity worker. You process donations. I oversee grant distribution for one of the largest healthcare foundations in the country, I said evenly. Last year we distributed $287 million in funding. Your hospital applied for $15 million. It was one of 43 applications reviewed this quarter. But, you work in nonprofit. That's not a real career. I chair a foundation with a $3.2 billion endowment. I supervise 63 professionals. My decisions affect hospitals, schools, and community organizations nationwide. University presidents call me. Hospital administrators call me. Research directors call me, because I control access to funding they need. Her breathing was audible. Why didn't you tell us? You never asked about my work. You assumed it was meaningless. But you let us think at Thanksgiving. Her voice cracked. You said nothing when I called charity work for losers. When I said you were wasting your potential. I didn't need to, I replied quietly. It shouldn't matter. The work matters regardless of who does it. Foundations fund the hospitals and research institutions that save lives. We're not glorified paper pushers. We're strategic investors in social impact. Your hospital needs us. Every hospital needs us. I'm sorry, she whispered. I didn't understand. You didn't try to understand, I said. For 17 years, you've dismissed my work without ever asking what I actually do. You mocked my career at every family gathering. You treated me like a failure because I don't drive a Tesla or vacation in the Maldives. I was wrong. I'm sorry. Can we reconsider the grant? That depends on your hospital's commitment to healthcare equity. We can improve our charity care percentage, she said quickly. We can develop outreach programs, whatever you need. It's not what I need. It's what underserved communities need, I said. And frankly, I question whether your hospital is genuinely committed to equity, or just willing to check boxes for funding. We're committed, Sarah insisted. I'll personally develop the programs. Submit a revised proposal, I said. Include a detailed equity plan with measurable goals, budget allocations and a timeline. The committee will review it fairly. Thank you, she said softly. Emma, I really am sorry. I had no idea you were so successful. I was always this successful, I said quietly. You just never respected the work. 2 weeks later, the revised application arrived. It was substantially different. Metropolitan Children's Hospital committed to increasing charity care to 15% within 2 years. They proposed a mobile clinic for underserved neighborhoods, transportation services for low-income families, and allocated $2.3 million of their own budget to equity initiatives. Sarah called after submitting it. I've been thinking a lot about what you said. You were right. I looked at our patient demographics. Really looked. We're serving mainly affluent families. Kids in poverty are getting cancer too, but they're not reaching us. That's not acceptable. No, it isn't. I visited 3 hospitals in low-income areas, she continued. Their facilities are overcrowded and underfunded, but they serve everyone. Their charity care percentages are over 20%. They're doing what we should be doing. That's good that you're seeing it. The mobile clinic was my idea, Sarah said. I want to bring pediatric oncology screening directly into underserved neighborhoods. Early detection saves lives. Kids in poverty deserve early detection too. That would make a significant difference, I said. Emma, I know I can't take back what I said at Thanksgiving, but I'm trying to understand now. Your work matters, really matters. You're making institutions like mine think differently about who we serve. That's the goal, I said. 4 weeks later, the grant review committee met again. David Kumar presented his assessment. The equity plan is comprehensive and well-funded. If implemented as written, Metropolitan Children's Hospital will become a model for accessible pediatric oncology care. My concerns are addressed, Margaret said. This is exactly the kind of institutional transformation we should support. Dr. Phillips smiled. Medical excellence plus equity commitment. That's what we look for. The vote was unanimous. We approved $15 million in funding, contingent on verified implementation. I signed the approval letter myself. That evening, Sarah called. We got it, Emma. We got the grant. Congratulations. Thank you for pushing us to be better. The mobile clinic starts in 6 months. We're hiring community health workers and partnering with 3 community centers in underserved areas. That's wonderful. I told Mom and Dad about your position at the foundation, Sarah added. They were shocked, completely shocked. Mom cried. She feels terrible about how they treated you. Dad wants to call but doesn't know what to say. Tell them I'll call this weekend. Emma, thank you for not giving up on us. Or on me. You could have rejected the application outright. I don't make decisions based on personal relationships, I said. I make them based on impact. Your hospital can now create real, positive change. That's what matters. You're incredible, she said. I'm sorry it took me so long to see it. That Christmas dinner felt different. Sarah arrived in her Tesla, but she asked about my work first. How's the foundation? Reviewing applications for next quarter. We are, I said. 62 applications so far. It'll be competitive. I can imagine, she smiled. The expertise required must be immense. Mom set down her wine glass. Emma, I owe you an apology. A serious one. Mom, it's okay. It's not okay, she interrupted. 4 years we dismissed your career. We made you feel small. We were wrong. Dad nodded. We're very proud of you, Emma. We always should have been. Uncle Robert added, I looked up the Martinez Foundation. You fund cancer research, children's hospitals, education programs, all over the country. That's remarkable. Aunt Patricia smiled. We're sorry for treating your work like it was trivial. It's clearly anything but. Cousin Jennifer raised her glass. To Emma, for doing incredible work even when we were too ignorant to recognize it. Everyone toasted. Sarah stood. I have something to say. Emma, you changed our hospital, not just by providing funding but by challenging us to examine who we serve. Our equity initiatives are transforming everything. We're reaching families we never reached before. Children are getting treatment they would have missed. That's because you refuse to accept medical excellence without accessibility. That's what the foundation does, I said. We invest in impact. You do more than that, Sarah said. You push institutions to be better than they think they can be. You demand that excellence include equity. That's leadership, real leadership. Marcus nodded. Sarah's applied your framework to everything. Our department is reassessing how we serve low-income families. That's the ripple effect we hope for, I said. One institution improves, others follow. That's systemic change. Sarah smiled. That's more impactful than anything I do in the operating room. I save individual lives. You save thousands by changing how institutions operate. Both matter, I said. Medical care and systemic support both matter. They do, she agreed softly. But I should have recognized that years ago. The dinner conversation continued, but this time it felt different. People asked genuine questions about my work. They listened. They respected it. It was what I'd wanted for years. But I'd also learned something vital. My work's value had never depended on their recognition. It mattered because of its impact, not their approval. The foundation would continue funding hospitals, schools, and community programs whether my family understood or not. Children would receive treatment. Students would get scholarships. Communities would access services. That was what mattered. Not titles, not recognition, not Teslas or vacation photos. 3 weeks later, Sarah's hospital opened its first mobile clinic in a low-income neighborhood. They screened 43 children in the first week and identified 2 cases of childhood cancer that would have gone undetected for months. Both children began immediate treatment, with good prognosis. Sarah sent me a photo. Children lined up outside the mobile clinic, parents holding intake forms, community health workers guiding families through the process. Her text was simple. Thank you for making us better. I saved the photo. This was why the work mattered. This was why it had always mattered. And finally, my family understood.